My name is Graham Donald. I'm a lay member of the SHOT Steering Group and of the National Blood Transfusion Committee, which both produce guidance about blood transfusion. SHOT stands for Serious Hazards of Transfusion and is the UK's professionally led haemovigilance scheme. In other words, its remit is to help make blood transfusion as safe as possible. SHOT produce a report each year highlighting issues with transfusion and making best practice recommendations to prevent them happening again. But what's my role in this? I have no medical qualifications, so why should I have a say? Shouldn't everything be left to the experts? Well, yes and no. The SHOT report is written by experts so as to be the best it can be, but it will often be used by health professionals whose specialty may be something else. Part of my role is to read and comment on the SHOT report in draft, and I always have this in mind. It helps patients, if those transfusing them, understand best practice, and if the leadership of health trusts appreciate that things can go wrong because of faulty systems and processes, for example. There's a personal aspect to my involvement. I vividly remember my mother being transfused about 10 years ago. She was in her late 80s and had dementia, so I was approached about it. Thinking it over later, the reasons for having a transfusion weren't properly explained, nor the alternatives, nor the likely consequences. But I was so upset and so taken by surprise that I didn't ask the questions I should have asked. My mother wasn't at the heart of her transfusion, I'm afraid. A lot of work has been done on patient consent since, yet there's still room for improvement. Not only must the transfusion decision be right, but the transfusion itself must be safely carried out before, during, and after. Although UK transfusions are very safe indeed, avoidable mistakes happen. If you've had any significant medical procedure, you'll know that everything is checked over and over again. Are you who you say you are? Is it definitely your left knee being replaced? Which of your teeth is coming out? And so on. Similar considerations apply to blood transfusions. Your identity should be checked and rechecked. 2 blood samples should be taken, not just one, and this checking should be done and the results noted straight away and at your bedside by someone focused totally on your care. If this isn't happening, you need to say something loud and clear. If you want to know more, please explore the rest of this webpage.